So the different ways that we could actually ventilate, remember we'd be doing compressions, okay, and then we would actually want to ventilate them. A couple things with this. The first thing is that I need to open the airway. We can't just ventilate them without an open airway. So how do we do that? For this position, where I'm doing one person CPR, I'm going to be ventilating the patient from the side. And the method or technique of opening the airway is called a head tilt chin lift. We're going to take our hand here, okay, we're going to simply rest it on the head, their forehead like this, okay, and I can do a head tilt and then chin lift. So really what we're doing is we're tilting the head back and we're lifting the chin forward. Okay, both of those are hugely important. The head, when the head goes back, that lifts the tongue up off the base of the throat. When I move your jaw forward like that, that is actually going to open up or move your epiglottis off the glottic opening. Okay, two of those are important. If I don't do those, when I go blowing them, their airway is going to be blocked and we're not going to be able to push air down them, okay? So head tilt, chin lift, head tilt, chin lift would be a method for me to open the airway. Once I open up the airway, I would want to give some breaths. And I have a couple options for that as well. I can do mouth to mouth on this person. I could use mouth to mask, or I could actually use a BVM, which we'll get into in a little bit. Well, let's run through mouth to mouth. Head tilt, chin lift. Okay, so the head comes back, chin comes up, and I would come down here. Now for this, I would kind of rotate my hand, pinch the nose, because if I'm doing mouth to mouth, I need to make sure that I pinch the nose. And then I would literally cover their mouth and I would give 2 breaths. 1 breath, 2 breath. Each breath takes place over about 1 second each. And I know everybody wants to ask, well, how do I know that I'm ventilating them appropriately? Well, what we would look for when we're in this position as I'm breathing is chest rise. So that's one of the best ways that I can know that my breaths are actually going in, when I see visible chest rise and fall. So that would be mouth to mouth. I could actually use mouth to mask, which would be much better. Okay, it offers me a little bit layer of protection from my patient and vomit and things that may come out of the patient's mouth. So same thing. When we put this mask on, okay, we're going to put it on from up above the nose, like this here. Make sure that it fits all the way around the bridge of the nose. Make sure that it fits all the way around the bridge of the nose and then around the cleft of the chin. So we put it on from the top like this, all the way over the nose, and that's how the mask should actually sit on the face. From here, what we do is we put this mask on over the bridge of the nose, around the cleft of the chin, and I'm going to take my hand, because remember I had a head tilt, right? I'm going to simply take these fingers here, put it over the mask, try to keep them high up on the mask, and then we're going to take this, and what we do is we just bend this finger like this. We're going to grab under the chin and put this thumb on the bottom of the mask. So what we're doing is we're compressing the mask against the face. I'm doing my head tilt, and then I'm coming here for my chin lift, and I'm securing the mask to the cleft of the chin. So head tilt, chin lift. And then I'm going to give 2 breaths. 1, 2. And each time I give those breaths, I can see good chest rise and fall. So again, coming from compressions, I would do my compressions, 28, 29, 30. Come over here, put this mask on the face, cover it like that. Head tilt, chin lift. 1 breath, 2 breath. Each breath takes place over about 1 second each.